Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Thank you for joining us today on Between Two White Coats. Today we're super excited to have Dr. Kevin Stadlbauer. He's a doctor of physical therapy with us today. Thank you for coming.
Awesome. Yes. Thank you for having me. Your podcast is wonderful.
I've
been able to listen, and it is just wonderful, practical information that I really hope gets to the masses, because there's a lot of confusion out there regarding healthcare, and it is just so enlightening to listen to you guys make it simple.
Well, you might be our new favorite guest.
Yes, thank you. Starting with a compliment is never wrong. Tell us a little bit about yourself. You know, Amber and I sit in this primary care space where we're sort of the jack of all trades, master of none. We greatly enjoy these opportunities to have people who are more experts in their field. And so being a PhD physical therapist, we're anxious to learn a lot of what sits in your head as common knowledge for you, but probably not so much for everyone else. Tell us a little bit about your training and your background.
Sure, yes. So I graduated from my doctorate of physical therapy program 3 years ago. So I'm relatively new in the profession, but not new to movement and exercise and the importance thereof. With my training, I've focused more on the musculoskeletal portions. So I do outpatient physical therapy, and what that means is people can get to the clinic where I provide the physical therapy. However, there are different realms of therapy, and like you said, jack of all trades, master of none. I am very interested and loved my schooling and learning about different specialties or subspecialties of physical therapy, and but I've focused my efforts into the outpatient realm, really focusing on pain, joint problems. There's a good bit more factors at play there, but not as specialized as maybe a neurological physical therapist or a pediatric physical therapist. So there are different realms, but yeah, I work specifically with adults, anywhere really from adolescence to I've had a 95-year-old in my clinic, and you would think they move just as good as a 50-year-old. It's just wonderful. So the outpatient realm is somewhat a mixture of everything, but there is specialties that go into that.
And so help people understand the difference between a physical therapist and an occupational therapist.
So good question. I think at times we struggle with that, but a lot of the times an occupational therapist will focus more on activities of daily living. In other words, feeding, manipulation of utensils, dressing. So they do a lot of hand, elbow, and sometimes shoulder-related activities. However, as far as functional, where we kind of mix there is we're all about function. So a physical therapist will do maybe the gross motor function, where they're more specific into the fine motor function of daily living, and helping them dress, bathe, cook, where we're looking at strength to be able to stand to cook, or endurance to cook, ability to exist in your environment so that you're moving about from point A to point B. You're able to balance comfortably. You're able to lift your groceries and put them in the fridge or in the cabinets. So different things at play there, but they do, an occupational therapist could do tasks that we would do, and similarly we would be focused on some tasks that they would do. So,
which I think helps with the confusion because there is a good overlap, and that you all often work in conjunction with each other.
Absolutely, yeah. The umbrella of function is really what we're trying to get at with helping these individuals get back to living a life that is independent of our care and independent, hopefully, of medical care in general, as they can.
And I think you just mentioned movement as independence, and that's a goal for all of us, like to have healthy aging and to be able to move and continue to care for ourselves. And so I'm thankful that you mentioned that, because I think physical therapy, a lot of times people think physical therapy is like an injury, type related or an orthopedic procedure, but it also can be like, extension of being independent as you age. Like you mentioned, balance and, walking from point A to point B. If you're falling or can't do that, then you're not able to be independent. And, we see in clinic like these sweet older patients, that want to still live in their own home that they've raised their families in. And, if they're continuing to have falls or balance issues, then it becomes unsafe for them. And then that's a heartbreaking thing for them, not just because they're losing their independence, but they may be losing like a home full of memories because they're no longer able to live alone.
Yeah, that makes me think it's an important question. When is physical therapy a good idea? When should a person be referred to or be seeking physical therapy?
It's a great question, and I think a lot of the times pain is the one, problem or impairment in life that people go seeking medical care for. You talked about falls. Those are two main things, or impairments, or reasons why we would see a patient. I think there's many reasons. I think one of a broad definition would be whenever you stop progressing and being driven, not necessarily being driven, but stop progressing in the direction that you had planned in life. If you had wanted to enjoy your grandchildren till the day you die, and you've stopped somehow and you don't know why, and there's no specific medical reason, and that's why we want to ensure a good relationship with their primary care or any other medical provider, that they're cleared to come to physical therapy, that there is no red flags. And of course, for the physical therapy profession, being a doctoring profession, we're clearing them of those red flags too. We want to make sure that this is a musculoskeletal problem. In other words, is it the muscles? Is it the skeleton? Is it the nerves, which play a vital role? But we do want to make sure that they're appropriate for physical therapy. And when I say physical therapy, we're getting physical. We're going to exercise, and that's a huge component of being independent and being able to play with your grandchildren the rest of your life.
Yeah, I definitely think that physical therapy is underutilized in many scenarios because it's not always diagnosis, treatment plan. Treatment plan includes physical therapy. It's really comes back to what you said before. It's function. When you're losing some function that is changing the way that you want to live your life. So if you're a grandparent who can't get down on the floor and get back up, that is instrumental for you spending time with your grandchildren. And doing the right kind of exercise and therapy and being guided. You don't have to lose that. I think so many times, especially with aging, we just think that, well, I'm old, so I can't do that anymore. But we don't have to take that approach. If you're losing some function, then what next? So now you can't get down on the floor. Next, can you not get off the toilet? And you can't live independently because you can't toilet independently. There's a lot of getting to things early helps us to maintain that. People start getting a little off balance. There's so many reasons, and it's important to get that medical clearance to make sure. Moving into who's not appropriate for physical therapy, I think you mentioned that making sure someone is medically cleared. Certainly if someone is not able to exercise for cardiorespiratory reasons, If your heart is not good and we really don't want to exert you, then we need to make sure that we work on that first before we release you to do things that will be exertional through therapy. Or if your lungs are not good and we need to work on that first. But there are plenty of times where people are clear to do, to start moving and to progress their moving. And the therapist is very well informed to know this person's not trying, this isn't the 30-year-old who had a knee surgery and is trying to get back to the basketball court. This is the 70-year-old who had a fall and a hip replacement, and they're trying to get back to independent living. And so, someone said to me once, and please forgive me because I say this all the time because I think it's funny, that PT stands for pain and torture. I know you've heard that, but I always tell my post-op patients, now remember, PT stands for pain and torture. These people are going to push you. But one reason that I say that to people is for them to realize too, that when you go to physical therapy, it is not the same as you trying to figure it out at home by yourself. Obviously, when you're post-op, there's specific things that need to happen for you to get that function back. These surgeries have made a significant difference in your hip, your knee, whatever it was you had operated on. So physical therapists are trained to know what has to happen post-op for you to get your full function back. But even when you can't get up off the ground, so you're not getting down there to play with your grandbaby, physical therapists know it's these specific muscles that are weak, that are preventing you from getting up, and we need to focus on those specific muscles, and we need to work on these exercises to do that. So you're going to have success in overcoming your barriers when you see a therapist a bit more than when you do a YouTube video and try to figure out, I don't know, is this going to work for me? I'll try to do it at home. And we will often push people when they are post-op and other things to make sure they follow the surgeon's instructions on following with physical therapy.
Say, do I have to go 3 times a week? Yes, you do actually. Like, they know what they're doing. They're there to get you better. I've had patients that even say, like, my physical therapist killed me this week. And I'm like, yes, that means you're doing the right thing. Like, you're like, if they have a shoulder replacement, I have one lady in particular, and she's like, now look to see how much more function I have. Like, she was able to show me, like, her range of motion had improved. And I don't think we take that for granted when you have not had a shoulder surgery, or if you've not had some sort of injury, like, you can rotate your shoulder. And people have said to me, and I've not really had any major injuries where I've had to do physical therapy, but like, when you don't have it, like, you can't move it, you realize then how much you were moving it prior to the event or surgery where you lost movement. And so that's why, like, having a regimen or some sort of prescribed dose, so to speak, of physical therapy. So what would you say to the patient that was like, do I really have to go 3 times a week for physical therapy?
Yeah, so it's a good question. I think each person in each case would be different based off their problem. Joint replacements are going to be a little bit more difficult. They're going to need a little bit more frequency. However, if we're dealing with a person who you just know that they're not going to do it at home, and there's going to be a compliance issue, then of course we're going to want to see them more frequently, because we know that dose does matter. We know that consistency is key. And if we don't get that consistency, outcomes are going to be poor, and they're going to go back into the system, get cycled through, and they'll be back at physical therapy again. So not that I say everyone needs 3 times a week.
Yeah.
But there is a lot of factors that go through our minds, and that's why it is skilled care. We're not just, a personal trainer or some athlete that, I work out a lot, and so I know how to make you work out a lot. We take into consideration who's this person in front of us? What do they need? And I know what I can do to make them get what they need. How good are they at doing that on their own? And sometimes I know that they're not going to do it on their own. So 3 times a week would be very important. However, if there's contextual factors of finance, then we discuss that. We discuss, okay, well, it's going to be a heavy, very heavily important for you to move forward independent of us. You can call me at any time. I always tell my patients, call me. Here's my email. I'll talk you through any problems you may be having so that you get the outcome. So, I think Can people do things at home on YouTube and try? Absolutely. That's the beauty of being human. We're adaptable, and we should try to the sense of. I don't think it's good that people try just anything, right? It should be sensible. And if you're trying and it's not working, that's when you need help.
And I like what you're saying about having some guidance and input from your physical therapist. So if you're meeting with a physical therapist and maybe there's a financial barrier, unfortunately, copays can be high for physical therapy, or a person may be self-pay. But working with a physical therapist to say, if I were to come in this amount and then you were to help me structure a home program, then we're doing it to meet the goals of what the patient needs with the education of the physical therapist that we don't have at home. I couldn't do this myself and figure out what exercises to do with a medical degree. Yeah.
Nor could we tell patients,
right?
That's not what we know.
Because you've taken years to recognize these muscles with these exercises are going to get you these outcomes. And even, how frequent and how many reps and all this is really important. So to be able to team with your physical therapist and come up with a program, if you're motivated to do at home, that you can check in with a physical therapist, do some at home, check in with a physical therapist. And if you're progressing and you're meeting those goals, then that's a great program. And if you're not progressing and meeting the goals, then that's not such a great program.
Absolutely. It's very important to team up with the patient and realize this is a team approach, not a me telling you what to do approach. This is, hey, let's talk about this. Let's see what's the plan that's going to make you the most successful. And really, we want to push them to being independent and then beyond, right? We want them to be physically active. We want them to meet the physical activity recommendations because we just know how crucial that is for them to stay independent throughout their lifespan. And if they don't, we run into these problems. Life happens to anyone. So, it's very much a team approach, and we value our profession, and but it's something that we learn, we grow, and we understand that there's not a silver bullet, and so everyone's going to be different in what they need.
Absolutely. I think that Amber and I, over so many years of doing this, have appreciated the difference in what happens when people utilize physical therapy, whether it's inpatient physical therapy in skilled nursing facilities or in hospitals, rehabs, whether it's outpatient physical therapy where you're going to the physical therapist and getting what you need, or home health physical therapy where the physical therapists are coming into your home and helping you to figure out the safety of your home and the exercises that can help you to navigate your home and your life. But all of these things, keeping people independent, keeping people moving, we don't people don't think about the musculoskeletal system as an organ until it doesn't work for them. And you want to talk about if you can't get up and walk across the room, if you can't push yourself out of a chair to go from sitting to standing or get on and off of a toilet, these are the things that really define your ability to live independently. And super crucial that we stay on top of that, because when we start to lose that, a lot harder to rebuild if you've gone really far down that road of weakness, as opposed to if you start to talk to your primary care early to say, a couple things I can't do. I'm starting, people never want to use their canes or walkers when they come to see us, our older patients or our weaker patients. Yeah. And no, this is the time that you need it. I'd really like for you to make sure you're using that. But I think they also want to present to us that they're doing well. And so unfortunately, sometimes we get into a room after someone else has already come in and sat down, and we get up and leave before they leave. And then I'll, watch them try to get in and out of the room, and I realize they've gotten weaker, and we just sat for a half an hour and they never mentioned that to me. And that's going to be the difference as to whether they get to continue to live independently in the comfort of their home or not. And these are the things that if you are noticing you're more dependent on assistive devices like a walker or cane, you're off balance more, you're struggling to go from the grounds to standing or from sitting to standing, these are the things that we want to know and get physical therapy involved in sooner than later. Let's not wait till it gets to the point of you can't do things at all, because that's a lot more to fight back from.
Beautifully said. Yeah, absolutely.
Very rare. I don't know that I've ever heard anyone, and it always makes me laugh when our patients that are, doing home physical therapy, their physical therapist is actually coming to their house. Like, they love those visits. Like, they're like, what else can I have a physical therapist come for? Very rarely do people complain about physical therapy if they have done physical therapy. Like, they see the value in that. And especially our sweet little older patients, they're like, oh, well, so-and-so came to the house and they did our physical therapy and they love it. It really makes them feel safe. And gives them back some mobility. So,
and I have my own personal antidote physical therapy story. I at age 49 was in a cartwheel contest. As it works out, I thought I could do 5, but 4.5 might be my max, and so I hyperextended my arm and injured my elbow in my cartwheel contest, and got the pleasure of seeing my friend the orthopedic and being referred on to physical therapy, and was concerned I was going to have all kinds of stuff done, but really physical therapy fixed what I called cartwheel elbow injury. But what I loved about it, and it comes to what you were saying, is there's so many things that are measured. So what I could lift initially and how much, there's so many numbers that I could see my progress. And so I could tell my arm was getting stronger. I could tell that I got full range of motion back. You can really, it is work, and it's, you have an injury. It's uncomfortable work. Sometimes painful work, but you can really see that you're progressing. And then at the end, and I was concerned that, for the rest of my life, I'm going to have this elbow that doesn't act right. And, now a year later, I don't ever think about my elbow. It's completely back to what it should be. I have retired from cartwheels.
No more.
Yeah, at least I think I've retired from cartwheels, but, and maybe lesson learned, but it was a great ability for me. I appreciated what physical therapy could do in theory, and then I got to appreciate it personally. And it was a great experience for me to understand that even that little thing, I could have let it go. It probably wouldn't have impacted my life profoundly, but instead I got full function back. So why should I have this bad elbow for the rest of my life when I didn't need to? There's so much about physical therapy. We utilize our physical therapist as part of our healthcare team. And I would just come back to saying, if there's something that you used to be able to do that you can't now, or something that causes you pain that didn't used to cause you pain, please bring it to your healthcare provider's attention, because we don't have to lose these things over time. And, when we've spoke before with Kevin, he points out to us, natural aging doesn't have to be losing function. And with the right team, and that often includes physical therapists, you can make sure that you don't lose function over time. We really appreciate discussing all of this with you, and we appreciate all of you all joining us to talk about what is physical therapy and when is it useful. We'd like to end you on a good note. Here's today's Tell Me Something Good. Teamwork. We do not get through this life alone. Whether your team is your family or your coworkers, or people who are just letting you get in front of them as they drive down the street and you're in a hurry. We work as a team better than we work solo. So do your best to appreciate your team and be a good team member. Thank you for joining us, and until next time, take care of yourself.